We're going to talk about different positions that you can do with an epidural during labor for pushing. Yes, you don't have to just push on your back, which is awesome. So the first one would be supported side lying. I think this one would be probably the easiest to navigate in a hospital setting as far as a more conservative provider so that you're not laying directly on your tailbone. But as you can see here with Nina, she's laying on her side supported by pillows, and I'm helping to hold up her leg so that she can take a nice deep breath in and do a deep push. Here you can see that I'm directing her to put her hand behind her thigh to use that as extra force to push down. But again, she's on her side, she's not putting pressure on her tailbone, and often it's a more comfortable position for both her and baby. Hands and knees is my favorite position to push in. Not only are you putting baby in a hammock position by having your belly rounded down, but it's also very comfortable and usually feels very safe even with an epidural. So you can see here with Nina, she is using the pillows, or we could pretend it's a headboard, to support herself and her belly, and then she's leaning back into each push. So she's going to take a deep breath. When she feels ready for the contraction, she's going to lean back and push using her muscles, using the force of her body, feeling safe, feeling stable, feeling comfortable. And again, baby's in that hammock position, like where the belly is hanging down, encouraging baby to get in the occipital anterior position, which is the easiest and most comfortable position to deliver baby. Supported squatting is often intimidating for people, but just keep in mind it's not like a CrossFit squat. This is a toddler squat that you can do in multiple positions. As far as the epidural, you're going to actually use a support bar or a support person and just kind of pull yourself into this squatting position. Again, it's having your feet flat, your butt all the way back on the floor or the bed, and leaning forward and using those muscles and gravity to help push baby out. And then of course there's the classic knees to chest. This position has its purpose and it's not something that you absolutely shouldn't do, but it's always good to try the other positions as well. So in this position, you're going to lay on your back, have your feet usually in stirrups, especially if you have an epidural, and then see how Nina is putting her hands behind her knees. She's pulling them back as she takes a deep breath and leaning over her belly. She'll show it again in just a moment. So she's relaxing. We'll pretend the next contraction is starting. We put her legs up, take a deep breath, and folding over her belly, holding the back of her knees. And again, she's using the force of pulling her knees and bending over her belly to help push the baby down. Sometimes this position can lead to some more tension or tearing in the perineal area, but it can be used to get baby out faster, and sometimes it's most efficient if you have an epidural. So really, it's just a great choice and a great tool. It's not something to be absolutely opposed to, but it's definitely a good idea to try all different positions when you're trying to push your baby out.